Describe some of the ethics which you are following in your profession.
Of course, a nurse should maintain some ethics in their life, such as punctuality, honesty, truthfulness. Moreover, it is highly important to maintain the confidentiality of the patient.
Tell me about a difficult situation which you experienced in your profession.
Once I had an Arabic patient who couldn't speak English, and I was not able to speak in their language. It was really difficult to understand his concerns. However, I handled the situation by seeking the help of a translator.
Could you please briefly explain your day as a nurse? Or describe me about your typical working day? Or describe me about your routine day as a nurse?
My day starts with a small prayer. Once I reach the ward, I acknowledge my work. Thereafter, I take the handover from my previous shift nurse and check the inventory allocated to me. After that, I greet the patients and assess them. Later, I plan the care for the day. Apart from that, I assist doctors in rounds and carry out their orders. Later, I give medications to my patients, and finally I record all the work I have done throughout the day. And at the end, I leave for the day after giving a proper handover to the next shift staff. In between, I tried to communicate and assist my colleagues wherever needed.
Do you believe that any gender difference or disparity still existing in this profession?
I don't believe that there is any gender difference in nursing. Previously, this profession was completely dominated by female nurses. But now the trends have changed and we can see a large number of male nurses in my profession. In almost all the departments.
What are the challenges in nursing?
Well, we face a number of challenges in our day-to-day activities. Some of them are sleep deprivation, staff shortage, overload and work pressure. Losing our social life is another one.
Any training or course you have recently attended?
I recently attended ACLS training, which is a course which helps or trains us to handle critical situations, especially cardiac arrest or resuscitation.
If you get an opportunity, what are the professions would you choose other than nursing?
Well, I think I will definitely choose teaching. Because I love the recognition and the respected teacher gets in her career. Moreover, like nursing, teaching profession also demands dedication and passion.
Tell me about your drawbacks and how do you overcome them?
I have some problems with my time management. I recently participated in a seminar which was conducted by the hospital management. It helped me to overcome my problem to a greater extent.
Could you talk about the risk involved in nursing?
There are certain risks which are involved in nursing. There are chances of getting chronic back pain and radiation exposure. And also, we may also get needle stick injuries. In addition to that, there are chances of getting infections, like TB or HIV.
How do you manage your stress at work?
I can manage my stress during work by proper planning. That is, I prioritize my patients based on their conditions. I will be able to attend all my patients on time with proper care.
How do you manage your time at work?
I usually manage my time through proper planning and prioritizing patients. And I can proudly say, I was never late in doing my responsibilities until now.
How do you deal with someone who isn't satisfied with your patient care?
There are instances where the patients are not happy with our care. Difficult patients have one thing in common. They are unhappy with some aspect of the service they've received at our facility. It's our responsibility to address the complaint diplomatically and ensure it will not negatively affect the patient's satisfaction. So if it happens, I usually listen to them carefully and identify their problem and empathize with them. Then I will try to find a better solution in case I am not able to do so. I'll definitely get the support of my seniors or any doctors.
Do you think nurses should attend continuous nursing education?
Yes. I strongly believe that the continuous nursing education program helps the nurses to update themselves with the current practices in profession. Moreover, it is mandatory to have specific hours of continuous nursing education in order to renew for nursing registration. Hence, continuous nursing education is extremely important for nurses.
What future trends can we expect in nursing?
Future is always unpredictable. However, considering the current trends, I would say robots may take over the medical field.
Why are you leaving your current position?
My last job was an opportunity for me to learn and grow at a comfortable pace in a smaller clinical environment. I am looking for new challenges and opportunities to continue to expand my knowledge in a larger hospital-based environment. I am eager to try new things and learn skill sets that come from working in a faster-paced environment.
What are the different roles of a nurse?
According to me, a nurse plays different roles in her profession. The main role of a nurse is caregiver. Along with that, she can work as an advocate for the patients or as a mediator or counselor, or sometimes she can be an educator for junior nurse.
Tell me about your strengths and weaknesses.
I strongly believe that I have a good communication skill and I possess good leadership qualities. Moreover, I really listen to what the patient tells me. Hence, I feel my listening skill is the best. When it comes to my weakness, I think I am a little stressed. Some critical situations make me nervous. However, I am managing these limitations by practicing meditation and yoga. The good thing is that I see lots of changes nowadays, and now I am more confident in handling any difficult situations.
What do you find most rewarding about being a nurse?
For me, the rewards of nursing never stop coming. Every day I'm learning and growing in many ways that are never dreamed possible. I feel so good when I see my patients improve and when I hold the hands of family members providing emotional support in times of tragedy. Helping people feels better than anything else I've ever done, and I get paid for it. It's the most amazing career I could imagine for myself.
What's the hardest thing about being a nurse?
For me, the hardest thing about nursing is the physical side. Being on my feet for an entire 12-hour shift, working night shifts and lifting patients takes a toll. I take weekly yoga classes and do CrossFit for stamina and endurance. The stronger I am physically, the better I can deal with whatever nursing throws my way.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating, and I'm equally comfortable working alone.